Hi, this is Mark Graven from KaiNexus, and today's podcast, we are joined by Mike McGowan. He's going to be presenting a webinar for us on November 28th at 1 o'clock Eastern. It's titled, How One Community Hospital is Creating a Culture of Continuous Improvement. And I would encourage you to come register, even if you don't work in healthcare. The lessons Mike is going to share are really universal, as are, the practices of lean and continuous improvement. Healthcare organizations have made the effort to learn from manufacturing. So sometimes it's interesting, I think, if you work in manufacturing or some other industry, to learn back from what people are doing in healthcare. And Mike is one of those people leading the effort in a hospital. So Mike, thank you for being here to give a bit of a preview in the podcast. How are you?
I'm fine, Mark. Thanks for having me.
So can you introduce yourself a little bit, kind of let the audience know a little bit about your background and your career path, and how did you end up getting involved in process excellence?
Well, I started out in laboratory science as a medical technologist and worked my way up through and became a lab director many years ago, and was faced with decisions in the lab about how are we going to face the future with less staff, as the workforce that I was working with started to age and retire. And it was the mid 2000s, and we started hearing about lean, and we did some work, and we did some work in the lab that was pretty successful at the time. In fact, I think when I exited the lab, there was a study done that we were 10 FTEs. We had 10 fewer FTEs than we should have had, probably, in comparison to other labs. And so that was a pretty successful piece, and the administration saw that it could work and suggested I go to Ohio State and study the Masters of Business Operational Excellence. Did that, and then we created a Department of Continuous Improvement, and I've been fortunate enough to lead that for the last 5 years.
Yeah, and talk about the mid 2000s. When I first had the opportunity to work in healthcare in 2005, it was part of ortho clinical diagnostics within Johnson & Johnson, and the hospital laboratories, medical laboratories were certainly on the forefront of adopting lean, and like you said, that often became kind of a proving ground or a foothold for the rest of the health system. So it's you were also, I think, on the forefront of some of that. We're kind of relatively early adopter, would you say?
Maybe in healthcare, maybe. I think it's hard to say. I think there were at the time, if you look back at the books that are out now, they were writing them at the time, and some of the Virginia Mason and some of those places they were going through, they had started. We were probably 5 or 6 years behind the rest of the civilized world, but we're trying to catch up.
Well, and it's a never-ending battle, right? Of trying to catch up with the best that you could be, and not just catching up to other organizations, right?
Right. Exactly.
Yeah. So in the webinar, you're going to be talking about creating a culture of continuous improvement. Can you maybe share just one key thing as a bit of a preview for the webinar on the 28th?
Well, I think for our team, it's going to come down to leadership and the pro and con of our leaders are very supportive of our department. They're supportive, the things that we do, but they haven't gone down into the trenches with us. And so it's kind of a double-edged sword of where, of what we need to have from them. So yeah, I think that's the case in any lean initiative or process improvement.
Yeah, and are there any? I'll ask you maybe for one other lesson, or it's a follow-up on some of a key when it comes to engaging frontline staff of trying to pique their interest in process excellence. What's something that you've learned about helping people get excited about the potential and the participation?
Well, what we found is that they get excited on their own when we show them that there's a different way of thinking and a different way of approaching your problems, and that we will help you solve your problems at the front line, and they can handle that, and they get a good sense of doing meaningful work. So we found that we don't really have to prompt them much once we show them that there are different tools that they can use in different ways to look at what they're doing. They get excited.
Mm-hmm. Yeah, I mean, you talk about meaningful work. One great advantage in healthcare is the strong sense of intrinsic motivation and mission and purpose when it comes to taking care of patients, whether the patient's right in front of you or, in the lab, the patient, presents himself as often a tube of blood or a specimen that comes into the lab. But, people are still really deeply committed to the purpose of their work. And, I think that's a challenge for people in other industries, whether it's manufacturing or service sector. How can we try to create a sense of passion around the company and the purpose? Hopefully others will can try to take inspiration from the work that's happening in healthcare, including the work that you're doing. So I'm looking forward to the webinar and glad that you'll be sharing kind of deeper lessons learned and kind of a deeper look into the methodology that you've used. So again, the webinar is going to be on November 28th, 1 o'clock Eastern. You can register by going to kinexus.com/webinars. Mike, thank you in advance for doing the webinar, and thanks again for giving us just a little glimpse into what we'll hear about here in the podcast today.
Thank you. Looking forward to it.